Dr. Srinidhi Kumar Acharya. Don't forget to get subscribed to my channel and also please give your valuable comments. You can also visit my playlist. In the playlist, I have provided almost all the topics so far we have discussed in a very systematic order. You can also make use of it. Anyway, my dear friends, we were discussing about approach to fever in children. And in the last one or two classes, we are discussing about the nature of the different pathogens. What is a viral nature? What is a bacterial nature? What is the parasitic nature? And what is the nature of non-infective inflammation fever, non-infective fevers? So that also we have seen. Previous that I told that to understand about the details of the fever, we have to ask 5 important questions to the parents. So previous to that, I have told this aspects. So these are the 5 important questions that we have to ask. One is onset of the fever, response to any of the antipyretic. I have taken the example of paracetamol because it is very commonly used. And then interfebrile period. What about the nature of interfebrile period? Then what is the rhythm of the fever? Then what is the response of the fever on day 3, 4 and 5? It means as the day passes, what happens to fever? Whether it increases, whether it decreases, whether it is stable, like that. And lastly, associated symptoms. So these are the 6 important questions that we have to ask whenever a patient comes to you. Parents bring their kid to doctor. So today we will start with the first important one, that is onset of the fever. So when the mother comes to you, ask the first question, what is about the onset of the fever? Whether the fever started at once, whether the fever started slowly, is it a very high fever, or is it a mild fever? So this is what actually you have to ask about the onset. Onset may be sudden, onset may be gradual, onset may be insidious, okay, and onset may be very rapid sometime, or onset may be sometimes spontaneous. So anyway, these are the questions. So suppose if the mother say onset is very acute or very high fever was there, and onset is very rapid. Okay, 1 hour back the child was normally playing, and within 1 hour, when I again check, the child is having fever. So this may be the answer of the mother. Morning hours he was absolutely fine, but by 10 o'clock he started with the fever. That means this particular onset of the fever is very acute. This is acute onset of the fever. Now, whenever we got acute onset of the fever, when you got the answer as acute or rapid or fast, then what are the possibilities that you have to think? It may be possibly a viral infection. I told in the beginning why viral infections are acute, because virus will go into release the chemicals at once. Suddenly when the chemicals will get released, the tissues get damaged, and as a result suddenly the inflammation starts, cytokine surge start, and fever will go into rise. Okay, so this is one condition, viral infection. Most of the viral infections, they show an acute onset. Similarly, other condition is malaria. Malaria is an example for parasite. I told in case of parasitic infections also, parasites usually get developing their offsprings inside a particular cell like RBC in case of malaria. So when suddenly get rupture, suddenly so many offsprings, okay, parasites are get released into the blood, and suddenly the body immune system is get stimulated, and the cytokine surge will be there, and this may lead to the sudden rise of the fever. This is also seen in case of parasitic infections. There are many other conditions, other methods to rule out one by one. This is only we are talking about the onset. So when the onset is very high, it may be a viral infection, it may be a parasitic infection. Then third is, sometime even in case of bacteria also, the onset is of the fever is usually bacteria will follow a slow onset. Gradually they start, then gradually raising. So this is a pattern of the bacteria. As the day passes, the fever goes on increasing. But sometime the fever may be very acute in some of the bacteria also sometime. Bacterial infection at the site of the entry, so may show the acute onset of the fever. For example, a patient with a tonsillitis, okay, patient with a bacterial tonsillitis, so he may develop a high degree of the fever. Okay, acute fever may be there in case of a tonsillitis. Okay, But when we talk about typhoid fever, this type of acute onset will not be seen. Most of the time, you will going to get insidious onset or gradual onset. In some of the what I told, site of entry. At the site of the entry, sometime the bacterial infection will localize at one particular point very fastly. Suddenly, when a bacteria get localized at one particular point, okay, within no time, then there may be high fever. Lastly, the non-infective immune disorders. Some of the non-infective immune disorders, that means immunological causes of the fever. Immunological causes of the fever may also have sudden onset of the fever. So in total, acute onset of the fever may be seen in case of viral infections, bacterial infections, parasitic infection, and immunological fevers. So we are not able to draw any particular conclusion, isn't it? But anyway, we have to ask the onset. In the coming slides, I will explain how we have to differentiate one by one. Okay, so onset may be very high or sudden in all the four conditions, but there are some exceptions are there. Bacterial infections, if it is not at the site of the entry, then it may be a gradual onset. Anyway, while the low or moderate fever, suppose the fever is mild fever, low degree fever or low grade fever, and a moderate fever may suggest some of the subacute infections. Subacute infections. Subacute means it's not actually acute, subacute. Okay, subacute infections may be there. A subacute viral infection, subacute parasitic infection, subacute bacterial, or subacute, the immunological disorders may be there in the low fever or mild to moderate fever. Another condition is a mild to moderate fever can be seen in case of a bacteremia conditions. Bacteremia, actually bacteria enter inside the body, but it is not able to find a particular site for its residence. Okay, so now it is not get localized, but it is roaming inside the body, in the blood. So in such condition, you can get a mild fever. Okay, mild fever you can get, and it is not a high fever, it's a mild fever. After some days it will be high fever once it gets localized. Okay, third one is poor immunity of the host. Suppose immune deficiency is there, poor immunity of the host. For example, child suffering from nutritional disorder, child suffering from some HIV like disorders, or some that means immunomodulatory, that means some of the immune related disorders. If the child is suffering, okay, nutrition deficiency is there, then although the infection is there, child may not develop good amount of the fever. Okay, so the reason is immunity is very less, because immune cells are not going at all there to fight. Okay, so all the fever is there, bacteria are coming, virus coming, but immune system is not at all going there, so there is no fight. When there is no fight means there is no much fever. Okay, because the pathogens are getting the upper hand. Okay, there is no fight, it's one-way traffic. So there also you may get less amount of the fever or low grade fever. So this is one slide where we have to ask onset of the fever. After getting through this slide, you may be now having confusion that yes sir, we have studied everything, but we are not able to come to a conclusion by the onset of the fever. Yes, by this, according to this slide, you are not in a position to have a conclusion regarding the onset of the fever, because all viral, it may be malaria, it may be bacterial, or it may be immunological, all the fevers may be acute, okay, high grade, okay, and sometimes they may be subacute also or mild also. So this is the first question. Anyway, we should know this. In the next class, I will explain how to differentiate these two. For the differentiation, first we have to look into all the 5 questions. Once we go through all the 5 questions related to the fever, then I will explain how to differentiate this. Yes, viral infection, by asking 2 or 3 questions, you can differentiate, yes, this is viral infection. By asking maximum 2 or 3 questions, you can see, yes, this is definitely a bacterial infection. So like that you can explain. So that we will see in the next class. Thank you very much.